Are you or someone you care about looking into buying a lift chair? Maybe somebody's having a total knee replacement or hip replacement, or they're just having a hard time getting in and out of the existing recliner they have at home. Hi guys, my name's Tony Maritato. I'm a licensed physical therapist. And in this video, along with an associated article, I'm going to give you all of the information specifically about Medicare Part B coverage, what Medicare will pay for, what they won't pay for a lift chair, how you can work with an occupational therapist or physical therapist to make sure you choose the best lift chair for your situation, and where you can go to find options for lift chairs that may or may not be covered by Medicare policy. Before we get into talking about Medicare covers, let's talk about the pros and cons of getting a lift chair and what a lift chair actually is. So typically a lift chair is a recliner that has a mechanism that hydraulically or mechanically lifts the chair. It typically lifts it and tilts it forward, so it helps the individual get up and get back down. A little easier, a little safer. Now, the pros of the lift chair are if an individual is having a hard time due to osteoarthritis or other degenerative conditions, the chair will help lift them so that they can go from a seated to a standing position. It also will help allow them to sit in a controlled manner if they have a hard time getting down into the existing chair. A lift chair also gives them more independence and freedom. So if they have to get to the bathroom or if there's an emergency in the house, they need to get up, the lift chair can facilitate that. Now, the cons of a lift chair is often patients will either purchase it out of pocket or have it covered partially by insurance, but they may not use it. They may not need it. And the biggest concern among both PTs, OTs, and family members is the thought that if you get a lift chair, it's going to allow you to become weaker because now the chair is doing the work instead of the muscles. I'm going to tell you, as a physical therapist, I've treated geriatrics in the home for over 2 decades. I do not believe that having a lift chair will cause somebody to become more deconditioned and more weak. I've just never seen that happen. If anything, what I've seen in practical experience is patients who are afraid or incapable of getting up and down, they don't want to bother family members, they end up sitting more. They actually become weaker in the long run than somebody who has a functioning lift chair who can get them up and get them back down safely. It allows them a little more freedom and independence. Now I was hoping to talk about 4 variables that are important to consider when purchasing a lift chair. So the first one is the individual's cognitive ability to manage and control the chair. I've worked with lots of patients who have various levels of cognitive decline. Some of them have become unsafe and unable to manage the lift chair. Of course, this is a situation where it may not be appropriate to allow that person to have a lift chair in their home. Lift chairs can be dangerous. There are stories of things getting caught under the chair. So I would recommend that a physical therapy or occupational therapy evaluation include a cognitive assessment to make sure that the individual is capable of managing and controlling the chair safely. The second variable is the person's ability to independently transfer in and out of the chair. Even though the lift chair is doing 80%, 70% of the work, there is still an important transition that once the chair lifts the individual 80% of the way, that individual still has to have the functional mobility to finish the transfer out of the chair or back into the chair without losing balance, without their legs giving way. An important component here is skin health and skin integrity. Oftentimes, I'll see individuals that are spending time in a lift chair or really any kind of chair. And if they're starting to develop skin breakdown, decubitus ulcers, or any kind of condition like that, we want to make sure that if they are using a lift chair, that they're not sliding in the chair because that could exacerbate skin breakdown even worse than it already is. And finally, we want to make sure that we can accommodate for balance and postural decline. Several of my patients have had severe rheumatoid arthritis that has caused significant postural changes, extreme kyphosis, or other curvatures of the spine, hip, knee, and ankle contractures that make it nearly impossible for them to stand independently. In a situation like this, if a person did decide to use a chair lift or a lift chair to help a caregiver go from transferring the person from sitting to standing, we want to make sure that we can accommodate the person's individual needs, their body structures, and make sure that they are doing it safely, as well as We want to make sure that we can train the caregiver or the family member in how to safely manage an individual in these transitions. Now let's get into what Medicare will pay for when it comes to a lift chair. The first part is, in most cases, Medicare will pay for a physical therapist or occupational therapist evaluation. Now, the therapist probably is not evaluating for the chair specifically, but rather the therapist is evaluating the patient for general mobility deficits, functional limitations, and overall impairments or decline. We want to establish a baseline measurement through physical exam, cognitive status, and other factors, past medical history, things like that, to make sure that, one, the patient would benefit from a lift chair, two, the patient or family and caregiver are capable of using the lift chair appropriately, and three, we want to make sure that the house is a safe environment and the lift chair is going to be positioned in the best place. So after the Medicare covered physical or occupational therapy evaluation, Medicare will also, with a physician referral and typically based on the recommendation of PT or OT, cover partial cost of the lift chair. Specifically, Medicare will pay for the lift mechanism, but not the rest of the chair. Often this will be approximately $200, $250, sometimes $300 of the total value of the chair. And I know several of my patients that have purchased lift chairs for family members or themselves. Typically, when Medicare covers that percentage, the remaining cost of the chair could be as little as another $100 or $200, or it could be as much as another $1,000 or $2,000. Some of these lift chairs have amazing features that are built right in. The 5 parts of eligibility for Medicare coverage of a portion of the lift chair are as follows. Number 1, your doctor or physical therapist, occupational therapist must determine that a lift chair is medically necessary and safe for you to use. Number 2, you must have a medical condition that makes it difficult for you to stand up or walk independently. Number 3, this condition must be expected to last for at least 6 months or longer. Number 4, you must be able to operate the lift chair independently or have somebody available, family or caregiver, to safely operate the chair for you. And number 5, you must be an enrolled Medicare Part B beneficiary, and you must work with a medical DME supplier that is contracted with Medicare. If you'd like any additional information or you want to find a Medicare contracted supplier who can help you get the lift chair of your dreams, go ahead and look at the link down in the description of this video and I will connect you with that article.